So I'm going to share you 7 key important rehab tips that you have to keep in your mind. Okay. First one is keep it simple. Keep it simple. The patient has a back pain try to improve the breathing first basically. Rather going for a expensive decompressive therapy, dry needling, so many machines treatment, keep it simple. What I told, what we know 30 years before electrotherapy came, we used treatment for pain as an electrotherapy modalities. What they said after that, electrotherapy only can help to reduce the pain. You have to do exercise at the end. So 20-15 years before, taping came. Taping practitioners have told you that taping can only help to reduce the pain. So again a supportive measure, again you have to do exercise or movements at the end. And the same way 10 years before, soft tissue mobilization and myofascial release, so many things are comes. After that also people say the same thing, that you have to exercise. Now recently triple certification, so many unnecessary stuffs, non-physiotherapy stuff they are practicing. Still they are saying the same thing, you have to do exercise and movement. So keep it very simple. Okay, so don't complicate yourself. Recovery comes from majorly sleep, proper nutrition, hydration 80%. If you achieve these 3 things properly, then go for ice bath, massage to get better. Okay, you're sleeping for only 3 hours and you're taking ice bath for recovery. Do you think you will recover better? So keep it very simple. Rehab plan, rehab has to keep it very simple. Second, focus on the problem, not the pathology. If you have a ACL injury also, you are going to strengthen the quadriceps, improving the range of motion. Osteoarthritis also, you are going to strengthen the muscles, other muscle, every muscle in the leg, and improve the range of motion, improve the quality of life. But treatment definitely slowly mostly treatment depends on the individual. Depends on the individual. Same condition, 10 individual will not have same treatment plan. Each individual will differ from the treatment plan to treatment plan. Okay, clear? It's very clear. So pathologies are important, not denying the fact of serious conditions. Rheumatoid arthritis need medications, some support. Fracture needs some days of immobilization. So pathologies are needed, but not that much. Even though fracture cases, each one problem will be different. Each one movement dependency is different. Each one pain intensity will be different. So focus on the problem, not the pathology alone. Focus on movement, not one muscle. Focus on movement, not when we do assessment also I told you, we can't test one muscle. We can't test one muscle. Okay, you are moving your hip external rotation, it's not you are only checking the piriformis. All the external rotator comes into play. Focus on the movement, not one muscle. Okay, clear? So have a clear plan. When do you will have a clear plan? When you assess the patient very clearly. Start assess the patient very clearly. What are the process of assessment? Listening, and history is 80% will tell everything. And then second step, pain analysis and examination or movement analysis, physical examination, then any investigation to confirm it. Your history collection should match with the pain analysis. Pain analysis should match with the physical examination. Physical examination match with the investigation. Investigation has to confirm the diagnosis. You have clear treatment plan. Where is affected, where is restricted, what to treat, what not to treat. Don't assume. Start assess. You assess, you have a clear plan and explain to the patient. Okay, what you are going to do, when you are going to do everything. You have to have a clear plan. But it's not possible to have a clear plan within 1 or 2 days. It will take time. But as soon as you get details, many details, just have a clear plan after that. Okay. Find a right line of exercise prescription is the key. Exercise intensity, repetition, volume per week. Finding right exercise intensity for the person, right repetition range for the person is the key. It is exercise prescription is not always 3x10. Keep in mind, exercise prescription is not always TheraBand, resistance band. Person can already lift 150 kg. How the yellow color TheraBand is going to work for the person? And also you have to understand the difference between rehab and training. It is a fine line. If you one box, the line, one part, this is a training, this is a rehab. Initial phase of an injury, rehab will be more, training will be lesser. And as the rehab goes, training will be more. In the rehab and training, there is only one difference, exercise intensity and exercise selection. Okay, for example, for shoulder, you are doing external rotation with a very 1 kg is a rehab exercise. For progressively, when the person returning to sports, you are doing forced face pull. Rowing, horizontal is the same muscle activation exercise. So, change of exercise intensity, change of exercise load, this is the fine line between the rehab and intent training difference. Okay, making the person or improving the person capacity is equal to load is called actually rehab. Keep that in mind always. So finding a right line for the person is key. Not 3 into 10, not same exercise, home program for 30 days is going to work for the patient. Progression overload should be there, specificity should be there, individualization should be there, variation should be there, exercise principle should be matched with that, volume, frequency, intensity along with that. And most importantly, which we have to understand, rehabilitation is not the really linear process. From A to B, okay, A is slowest, painful, very severe condition, B is improved state, means you put on graph. Person A to B will not travel everyday improvement. Like 4 weeks or 5 weeks, 10 weeks of treatment is not everyday improvement person achieve this state. Okay, rehab is not a straight line. Rehab is always like this. Person will progress nicely. One day suddenly the person pain will come back, stuck and improve, decrease, improve, good. But at the end the person will achieve what they want. So rehab is not always a straight line. 1 week later, if you found tomorrow you started prescribing exercise to the patient aggravates the pain, you did some mistake. Think, sit, keep it simple, relax, improve your ability, improve your thinking, you will get better. Understanding. Okay, it's not necessary you did something wrong. Wait and see. Listen again. Clarity, treatment plan, strategy changing is the important aspect. Finally, don't forget to individualize, as I already said. It's not about the pain. It's all about the person who attached to it. Hopefully, you got it the 7 points very clearly. Anyone have any doubts?